Causes of kidney stones. Several factors can contribute to the formation of kidney stones. More men than women develop kidney stones. In the United States, white people are more likely to have kidney stones than black people. Here are the common causes. Dehydration. Insufficient fluid intake can lead to concentrated urine, making it easier for minerals and salts to crystallize and form stones. Staying well hydrated is crucial in preventing kidney stones. Dietary factors. Certain foods can promote the formation of kidney stones. Diets high in oxalate-rich foods, such as spinach, beets, nuts, and chocolate, can increase the risk of calcium oxalate stones. Similarly, diets high in animal proteins and salt can lead to stone formation. Genetics. A family history of kidney stones can increase an individual's susceptibility to developing stones. Genetic factors may influence the way the body processes substances like calcium and oxalate, making some people more prone to stone formation. Medical conditions. Certain medical conditions and metabolic disorders, such as hypercalciuria, excessive calcium in the urine, hyperparathyroidism, and urinary tract infections, can increase the likelihood of kidney stones. Inflammatory bowel diseases like Crohn's disease and gastric bypass surgery can also lead to changes in the digestive process, affecting calcium absorption and increasing the risk of stones. Obesity. Being overweight or obese can alter the balance of substances in the urine and promote the formation of kidney stones. Medications. Some medications, including diuretics, calcium-based antacids, and certain anti-seizure drugs, can increase the concentration of minerals in the urine, contributing to stone formation. Urinary tract abnormalities. Structural abnormalities in the urinary tract, such as kidney cysts, blockages, or narrowing of the ureters, can disrupt the normal flow of urine, leading to stone formation. Lifestyle factors. Sedentary lifestyle and lack of physical activity can impair the body's ability to process calcium, increasing the risk of kidney stones. Additionally, excessive intake of sugary beverages and a high-sodium diet can contribute to stone formation.